All right, today we are going to talk about how to talk about pressure with clients, and I am going to say something a little radical, which is I hate the question, how's the pressure? Let's talk about that. When you ask a client, how's the pressure? What's your experience? Let us know in the comments below, because my guess is that most of the people that you ask that question to will say something like, it's fine, and that's it. They don't really give you any useful feedback to work from. That's the best case scenario, is maybe it is fine. A lot of people will be people pleasers and actually tell you it's fine when it really isn't. And I've got plenty of historical data between people who have given me feedback and also people who have given feedback for sessions with our therapist, that a lot of times clients will say the pressure's fine, but then complain about it afterwards and think that the therapist did too light or too much, and they don't really talk about it, right? And so you think when you're saying to the client, how's the pressure, that they're gonna give you a real answer and start a real conversation, but I will tell you that that almost never happens. So what to do instead? And so this is what I train all of my therapists and how I would recommend talking about pressure so that you really can dial in the pressure to exactly what clients want. And so I'm gonna give it to you word for word, steal it from me, use it. Here's what you should ask. If I gave you a scale from 1 to 10, with 1 being barely touching you and 10 being totally unbearable and excruciating, where is my pressure right now? Now, why would I ask it that way? 1, I'm not asking a client to judge me. I'm just asking them to give me a scale on what they're feeling right there and then. So instead of asking them if the pressure is okay, I'm asking them to tell me what kind of pressure they're feeling. Why does this help, right? So let's say in my brain, I'm thinking I'm giving a 6 pressure. If the client tells me that's a 6, that's great. I know I'm calibrated. I have a pretty good idea that the pressure that I think I'm giving is what they're feeling. And then we can have a simple conversation around what's a good amount of pressure, whether it's, on the lighter end of a 3-4 or on the heavier end of a 6-7. What's gonna give you the most therapeutic results? I personally think it should average somewhere around a 6. But that's because I do more deep tissue work. If I think I'm giving a 6 pressure and a client tells me it's a 2, now I know I have to actually sink in more to give them what they're looking for, right? And so then I can sink in my weight a little bit more and check in again and try to find where I think I'm giving a 5 and they tell me I'm giving a 5. And then I know that my pressure is calibrated, and then we can continue for the rest of the session, and I know in my head that I've got a good idea of what's gonna help them and what they like. On the flip side, if I think I'm giving a 6 and the client tells me it's a 9, I know I've got to lighten up a little bit and back out and bring it back into that 5-6 range so that they're comfortable again. And so the first reason that this question works so well is it gives you an opportunity to calibrate what you think you're doing pressure-wise to what the client is feeling pressure-wise. So you want to make sure those two things are at the same number. And then you want to have a conversation with the client that basically says, hey, the best therapeutic results generally happen somewhere between a 4 and a 7. How do you feel about us sort of averaging around a 5 or a 6 today? And they can tell you, great, that sounds great. Or maybe I want you to go a little lighter today because I'm a little bit stressed out. Or you'll get a client say, let's go for the 7 today and see what happens, right? And then you get to have that conversation, you get to have an agreement about what kind of pressure they're looking for. And since you've calibrated your pressure so that you know that your feeling of a 6 matches their feeling of a 6, then you know throughout the rest of the session that you're going to be way more on target with what they're looking for and way less likely to give something that makes them complain about it after the fact. Now that you know a better way to ask about pressure with clients so that you will actually get feedback that is useful to you, if you want to learn how to get better at giving good pressure and good control of pressure, watch this video.